So you would be familiar with the Gallup poll. It's been around for 20 odd years. They've done tons of research into what makes an organisation great and what makes a leader great. And I've taken the liberty to highlight in yellow all the activities that as a manager and a leader that pertain to you. And if you look down the list, it's things like valuing your team, respecting your team, appreciating them, listening to them. Your team want to know that you care about them. Now, I know on paper everybody wants this and everybody thinks that they do it, but often there's a mismatch between your behaviours and your triggers, how other people trigger you, and how you behave. So the key thing with leadership now is we're looking at a more distributed leadership model, encouraging other people to get their own inner leadership. So we're looking at things like influence and engagement, not authority, which is that old level of hierarchy in healthcare. So the knowledge trap is the name of the second chapter in my book. What it talks about is the more clinical knowledge that you have, and you tend to focus on clinical outcomes, sometimes you're not the best leader when you do that. Because what that means is you're not focusing on how to get other people to do the job that you used to do when you were operating clinically. So how can you do that? This is a model of emotional intelligence that I use with my leaders when we're doing programs. And you can see that there's two different halves. One is self and one pertains to others. On the self side, there's self-awareness and then there's self-regulation. And it's not just emotions we're talking about, it's also energy. And the other part of self is how do you motivate yourself? And I don't know about you, but I can be a very big procrastinator and I can avoid difficult conversations like the best of us. But we know in leadership you can't do that. You can't avoid timely feedback for other people because there's implications, clinical implications. And we know leaders now are not just leaders of people, but they're also leaders of their own energy and also the energy of their team. So the other half of the emotional intelligence story looks at others. How are you aware of other people's feelings and their thoughts? And how are you picking up on the cues? And then how are you responding to that in a meaningful way? Now, on this slide, there's really great questions around how to improve your own emotional intelligence. And when I do the inventories with a lot of nurse leaders, what's lacking is this social regulation part, knowing what to do with the information and the cues that you're picking up. But it says, how can I positively impact this situation to leave it better than before? And so I'm going to show you a model that you can start to apply in your leadership journey that's going to help you with this, because this is often what's missing.